Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and Kaigenesis, our supplements designed for people people diagnosed with chronic kidney disease. And I'm joined again today by the lovely Lindsey Zirker. Lindsey is one of the head renal nutritionists at Kidney Nutritional Institute. She is a gem when it comes to all things autoimmune related and kidney disease. So any of those sort of things, she's your master there. But she's also a master in all things minerals and kidney disease and just minerals in general. So we've been slowly working our way through the minerals. I know Lindsey's she's like me, a ferocious studier and likes to go down rabbit holes, and then we have to pull her out after a little bit and say, Lindsey, come back to us. And then she tells us everything she found down the rabbit hole, which is what I love about her so much. So, Lindsey, thank you for being back on the podcast. How have you been?
I've been great. Thanks so much for having me back, Fiona. I do love to share what I learned just because I think it's so fascinating. And I think it's nice for people to, understand what's going on in their body. So
Yeah. And I know we did, I think it was, I can't remember which mineral we did last time. Was it magnesium, potassium? Was one of those ones.
I
So maybe we
maybe it
talk
was,
about
I don't know.
but zinc is such an important one. And the other thing I forgot to mention when I was introing you, which I find really fascinating, is you've done a lot of work with the roles between minerals and hormones, which is
Mhm.
something, in our naturopathic degree, we learn on a high level, but you've really gone super in depth to that sort of stuff as well. So it might get you to touch on that because, yeah. So first off, zinc. Tell me what, let's, for people out there that may not know anything about their minerals and things like that, give me the 101 on zinc.
Well, I think the reason that you and I love zinc so much, kind of like with magnesium, it's involved in so many different things. It's really a busybody. Um, so a lot of times people may think of it as like kind of the more primary roles we hear about is its role with supporting a healthy immune system and then its role in helping with wound healing. But zinc does a lot more than that. It's really important for cell growth and division. It plays a role with our taste and smell, which I think a lot of people have also recognized with recent things
Mm-hmm.
going on.
Yeah.
Um, it's really important for producing proteins and DNA synthesis. It helps with our metabolism in general functioning and helps reduce oxidative stress. And also a recent one that I learned about in looking at the hormones and stuff, but uh, the the enzyme that helps your body regulate blood pressure, the ACE enzyme, it has zinc is a part of that. And so zinc plays a role with that. And I was like, well, who knew that zinc was, involved in blood pressure? Well, now we know. So
Yeah, and it's not one we ever get taught as thinking about zinc and blood pressure. So that's fascinating. And you're right about the taste. So if anyone was wondering what Lindsey was alluding to, it's obvious. One of the things that can happen in post-COVID is people lose, or during COVID, is they lose their sense of taste and smell. And that is very generally related to a zinc deficiency because your immune system has gobbled up all the zinc in trying to get your immune system to operate properly. So yeah, zinc is a super important one. So zinc deficiencies, how common are they? Are they something that you see a lot in clinical practice? Because it's definitely something we see, or I see as a naturopath, very commonly in clinical practice.
yeah, I think a lot of times, like in dialysis and stuff, we don't get a lot of opportunity to focus on zinc. Phosphorus is kind of the superstar there. But when you know what the deficiency symptoms are of zinc, then you're like, oh, it's really common. Um, and I think the hallmark ones that I see the most commonly, like when I see these three things start happening to my patient at the same time, I'm like, oh, okay, zinc is hair loss,
Mm,
diarrhea, and
mm.
fatigue, and sometimes the taste change as well. Or sometimes they won't feel like it's a taste change, but they'll see an appetite drop and they don't really correlate it with taste change, but their appetite goes down because things don't taste good. And they just think, oh, I'm not hungry.
Yeah,
And
okay.
And so I think that's really important to recognize because I think hair loss is super common with our population. But
Yes.
there are a lot of reasons why hair loss can occur. And so everyone's like overdosing on biotin. And there's really not actually, I was so shocked to find there's actually no literature that says, if you have hair loss and you add biotin in, it's not going to help you grow back more hair unless you're a child, even though hair loss is a sign of biotin deficiency, which is super weird. But
Yeah. I
yeah,
find biotin strengthens hair and nails,
yeah,
but I'm like you, I've never seen it increase hair production.
yeah. So
Mm.
we want to look at zinc or vitamin D or iron or other things like that for your hair loss, guys. Don't OD on the biotin.
Yeah, very true. Now, let's dive straight into zinc and kidney disease. And I definitely want to talk about testing and all those sort of
Yeah.
things, how reliable they are, and then forms of zinc. But why would someone diagnosed with CKD be thinking about zinc as a potential thing for them to
Yeah.
think about?
There's definitely a few reasons. The biggest reason I think is because urinary zinc wasting is super, super common, even as early as stage 3. So you're just peeing out more zinc potentially. And
How does that
so,
happen with kidney disease? How's that part of it?
sorry, what was that you said?
How's that part of kidney disease? So is that just part of what happens because the kidneys have lost structure and
Mm.
integrity that it's not, it's an issue with reabsorption, or is that how that works? Or
Yeah, I haven't found like super definitive, like it's, lack of reabsorption or because, the filter is just, letting everything out willy-nilly. And I also didn't find anything that said it was specific for certain types of kidney disease, like if it's more common in um, diabetic nephropathy or IgA nephropathy or anything like that. It just said in kidney disease, urinary zinc wasting is common. And
no.
so I definitely think there's more, digging to be done there. But based on, symptoms that my patients deal with, if we ever have a chance to assess zinc, I'm like, yeah, I totally buy that.
Fascinating. Okay, I interrupted
Yeah.
you. So
No,
zinc.
that's totally fine. So yeah, I don't have as many details as I would like on that. Um, but there's also other causes that people with kidney disease could have lower zinc levels. Um, if they have reduced appetite, like especially in the later levels of CKD where that uremic symptoms, kind of take over and suppress the appetite, you're just eating less. And then you're also probably not wanting to eat the foods that are high in zinc, um, or that are the most bioavailable or easily absorbed in zinc, which is, going to be your animal proteins. Interestingly, oysters are super good source of zinc, but like beef, chicken, and fish, when you don't feel good, those aren't typically the things that you crave. And then kind of going along with that, a lot of our patients that are trying to do conservative management, they're choosing lower protein diets, which by necessity means that you're having smaller portions of protein dense foods where that easily absorbable zinc is found. And so they're going to be at risk there. And then, of course, there could be medications. People are on. My favorite soapbox is omeprazole because I love to hate it so much. And you're just not going to have really good absorption of anything when you're on omeprazole. But, you do have to have stomach acid to help absorb that. And then it kind of becomes this, cycle where you have to have zinc to produce stomach acid. So if the omeprazole or other things cause you to not absorb zinc, then you're going to be even in more trouble because you can't produce stomach acid to help that if you don't have the zinc to do that. So, uh, yeah, so there's definitely a lot of reasons why zinc can be low in people who have kidney disease.
And does zinc play a role in kidney disease in the fact that can a zinc deficiency be a contributing factor? And what does the body or the kidneys use zinc for? Is in part of their process? Is that something where if you get really deficient, you're going to slow down your ability to repair kidney disease? Tell me more about that.
Definitely there are some correlations. I feel like the research is still pretty vague on it. But some of the research that I've looked up specifically said that zinc deficiency on its own is a risk factor for progression of kidney disease. Now, because zinc is involved in so many things, I feel like it is really hard to pinpoint why that's occurring. Like, if it's not able to help heal and repair tissue, that makes sense.
Yeah.
Um, if you have protein and DNA synthesis inhibition, like again, kind of going along with that. But
Mm.
also, zinc plays a pretty significant role in blood sugar management. So, where we have diabetes is the number one cause of kidney failure, it makes sense that, if you have low zinc, then that's going to exacerbate things, because zinc helps with, well, they found that zinc deficiency is associated with reduced insulin sensitivity. Zinc is actually required to make insulin, and it also helps with the skeletal muscle and insulin signaling, where a lot of, that insulin is needed. So, yeah, kind of interesting with that, that, zinc is involved in so many other things. But I didn't find like really specific, you know,
And
things
I
with
think
it.
they're
It's
like that
just,
with the minerals, aren't they? They're very like
yeah,
they do this, and they're really they work inside sort of as an orchestra of everything else.
yeah,
And like I say, zinc and magnesium, like, is it over 200 or 2,000 metabolic processes that they're involved with pathways in the body? I think
either, both.
it's a two with some zeros. I can't remember which one it is. No, it's a lot, and I know zinc and magnesium are the two biggest ones,
Hmm.
and it's interesting that when you are losing your taste, and you can probably explain this better than me, that we always say when people are starting to lose their taste, it's because zinc has been channeled into other areas that are far more higher priority.
Critical. Yeah.
Yeah, that's what I'm looking for. So zinc in taste is one of the first things that will go, because the
Hmm.
body, that's not as critical as maybe it is in some of these other biochemical pathways that it regulates, and so it's losing it there first. So when you start to see loss of taste and hair, which the body goes not really necessary to all the other enzymes, zinc has been reorganized in the body to really where else it needs to go. But really big signs. And fatigue was an interesting one. That's not one that I generally put together with zinc. So I was really fascinated. And it makes sense, of course, for you to put those as sort of the three big things that you look at with the diarrhea, the fatigue, and the hair loss, I think you said, didn't you?
Well, I think like fatigue is a difficult one because there's so many things that can cause fatigue, but where, you know, a lot of times, like let's say, we have a CKD patient, we're like really good about covering our bases with B vitamins and stuff. And then if they're on a lower protein plant focused diet, then iron is also typically covered pretty well, which is another one we typically associate with fatigue. And then, you can have fatigue from the buildup of uremic toxins or like any other number of things. But I feel like when those three things start together, because of zinc's role with regulating metabolism, I think that's why, you know, we feel that fatigue if it's not there. And then, we just are like, oh, you started having diarrhea, had your hair fall out, and you're tired. Those three things kind of started around the same time. Red flag. Let's look at your zinc.
When you say look at your zinc, how are you measuring it? Because it's like magnesium. We always say, well, plasma is going to show you nothing. So what sort of testing are you doing for zinc, and what do you find the most accurate?
So, like we kind of mentioned, either in the magnesium, which I'm like, does that podcast exist? Did we do that? But for sure, I know we talked about in just minerals in general,
Yeah.
um, that the mineral status in your serum or your blood is going to be significantly controlled by different hormones. And so that's part of the reason why just looking at serum levels is not going to be very accurate most of the time.
Mm.
So for some minerals like magnesium and zinc, a lot of times people are looking at red blood cell levels instead, because that's going to be a little more accurate. But that's going to be looking at more the past couple of months. And so that's a little bit of a challenge because in our population, if you had a person come to you and let's say for, you know, 2 months they've been on a low protein plant-based diet, but before that, you don't really know what they were doing. It's kind of hard to know, like, was it the shift to the diet now, or is it just because that's just the time that it took to deplete their nutrient stores? So it's looking back a little ways. So I always feel like because lab tests are really fallible, it's helpful to look at if there's a couple of lab tests, but then you're also looking at what their risk for deficiency is, looking at what their intake is like, and also looking at their symptoms. Then you kind of add them all up together, and then you're like, okay, let's do this. So in addition to red blood cell zinc, there's another test you can look at, which is called delta 6 desaturase, which I did not know about this until I did a Nutri eval with one of my patients. And yeah, it showed that her zinc was like, subpar, but her intake looked good. And so I
Mm.
was like, what is going on with this? So I'm looking throughout the rest of her Nutri eval, and the delta 6 desaturase is in the fatty acid section because that is one of the enzymes that helps convert the different fats to the different fatty acids. Um, and so I was like, what the heck is this? So it is zinc dependent. And so you can see if that is impaired, then you don't have zinc. And so when I looked at this patient, I kind of took a step back because I was like, this is weird. What's going on? I was like, she was on a vegetarian diet for 2 years previous to me doing this. And even if she did get adequate zinc, vegetarians naturally do have a reduction in stomach acid. And
Yeah.
then if her zinc was low, then again, we see that exacerbation situation. And so I was like, okay, so she had low zinc from that. And we know she's got some gut issues. She had a bunch of stuff going on there. So for me, I was able to look at it and say, okay, I can see that her intake is okay, but because of her previous lifestyle and things, that her stomach acid hasn't quite caught up with things, and because of the impaired zinc. So what I did was, yes, I did give her some zinc, but what I really did for her zinc was I gave her digestive enzymes, and we worked on her gut so that she's hopefully not on those forever, but that's what we did. And so you do want to look at root issues as well. So those are kind of the two things that I usually look at. Um, and then zinc copper ratio can also be helpful because everyone gets freaked out. Like, you can't supplement zinc because then you're going to get depleted of copper because they compete to be absorbed. But uh, copper is pretty common in the diet, and if you like potatoes, it's like a super awesome source of copper. So you're probably fine. But you can do a blood test that can give you the zinc copper ratios so you can make sure that things are savvy there. And then if you do any food tracking, a lot of the food tracking tools will put the zinc copper ratio in there for you. So again, it helps you make sure you stay in the lane there. And the the zinc copper ratio is anywhere from 8 to 15. So you can kind of know that you're in an okay space with the supplement. So
Yeah, and it's interesting, I do the NutriStats in Australia, but they're very similar to the NutriVal, and I would say 9 out of 10 times people have excess copper to zinc ratios every time.
yeah, from too much copper, not too much
Yeah,
zinc. Yeah,
correct.
yeah.
Yes, yeah.
Hmm.
So, and the other test we use as naturopaths, I don't know if you use it over there in the States, it might be a very Australian, New Zealand thing, is we have a zinc tally test. So you give people a drink. Yeah, you get them to drink pure zinc. I think it's in a sulfate form. And if they cannot taste it within 10 seconds, they're zinc deficient. So it's just looking at the taste test.
Mm,
That's a zinc taste test.
that's cool.
Yeah, it's a nice, easy one. It's one of the first tests we do. And it's interesting when people come in to see you as a naturopath, one of the first things you do is you give them a zinc taste test. So we are always looking at zinc as one of the first things that we could easily look at potentially treating in people because of how important it is. That magnesium is some of our biggest things that we supplement right off the get-go for people, because you get those right and optimize all the pathways you spoke about. You get your hormones slightly better, and then you can properly optimize people behind it. So yeah, it's fascinating.
Yeah, I totally agree.
Okay, so zinc supplementation, talk to me about that. So if someone's like, well, okay, I think I'm deficient in zinc, are there, because there's so many different forms of zinc picolinate, zinc citrate, and if someone with kidney disease, is there a form that you prefer, or one that you think has benefits over others?
So the research says that the most optimal form is zinc gluconate, or one with amino acid chelates. And so that's, a common one. I usually use the zinc from Pure Encapsulations because it's super budget friendly, and they have it in 15 milligrams or 30 milligrams. It is a zinc picolinate. And I have seen my patients' zinc deficiency symptoms go away. So, and if we do any repeat nutri-eval, their zinc levels are improved. So I feel like it works well enough. And I think that, there's definitely different options, and there could be other reasons to use one form of zinc over another, but that is a rabbit hole that I, as of yet, have to explore. So,
Yeah, I can tell you in Australia, most of our products are the zinc gluconate. Did you say that?
mhm,
Yeah, that's the major form. You'll see it here. Um, and then picolinate seems to be the form. Fawn and other brands like that tend to use that. So I use that a lot. Same reasons you, I used to see zinc deficiencies go away for the most part.
mhm,
Zinc carnosine that a lot of the gut formulas use. Zinc carnate, zinc.
zinc carnosine.
Yeah, that's in all the gut formulas, because zinc is one of the greatest nutrients for healing leaky gut syndrome. So if you've got like a gut formula, you'll generally have glutamine and zinc, and then however else they want to put stuff in there. So you'll see that one a lot for gut health. And then in like in our alkalizing formula and things like that, then we come across zinc citrate being an alkalizer. So it doesn't seem to boost zinc levels as well, but it's great for people where you think, well, they need to be alkaline. Maybe acidity is part of the reason cellular uptake of minerals isn't working. And so then I generally use the citrate forms if I'm using a citrate formula with potassium and calcium and magnesium and things in there. So, but yeah, no, you're right. That's the picolinate's my go-to for just general zinc deficiency. That's what I'd use as well.
Yeah, if I definitely agree with the gut healing one, with the zinc carnosine, especially if I have clients who've done GI mapping and we see like they have H. pylori and stuff like that, because that's part of the reason people get diarrhea with a zinc deficiency, is because zinc is so powerful at fighting gut pathogens. And
Mm.
so, yeah, if you have leaky gut and then you've got some, overgrowth of things in there, then the carnosine is a really great option.
Yeah, no, I agree. Okay, so is there any side effects or things that you worry about when you're supplementing with zinc, or any problems that you see with zinc toxicity or zinc going the other way?
I actually haven't had any problems with that. I think I am fairly conservative with the zinc dosages. Like, if people have gut issues, I'm usually more like maximum of like 30 milligrams of zinc. And then otherwise, like, I stick between that 15 to 30 milligrams, and it does seem effective for most people. So I haven't had any major like I haven't had any personal experience with like zinc toxicity or anything like that. Um but it is important to recognize that if you also like maybe have an anemia issue or something and you are on a higher dose of zinc, You want to take the iron and the zinc supplement separately. If you take with more than 25 milligrams of iron with zinc, they won't absorb. And so you want to keep those separate. Um, so that's kind of like the main the main thing. I just think most people are so low that their bodies are just grateful when they get it.
I'm the same. I tend to stick from 15 to 30 milligrams. It seems to be the range of where it seems to work for people. So, and then quick question, just because you are a genius on this stuff, and you sparked a question in my brain when you said that multivitamins and minerals that have copper, zinc, magnesium, all the things that compete with each other for absorption in one capsule. Thoughts?
Yeah, I tend to stay away, especially from the ones that have iron in them, mainly because iron seems to have the shortest half-life. And so I feel like the quality isn't going to be very good. And it really seems like iron interacts with a lot of different ones. So I do like to have them separated. I feel like that I've definitely used different ones where you have like the vitamins in one supplement and the minerals in another supplement. And for myself personally, I actually do take them separately. I take my vitamins in the day and I take my minerals at night. And if I need something in between to get me through the day, then I take that at lunch.
Yeah.
So I think that, you know, if you're like the averagely healthy person and you're not like super diminished in your nutrients, I think having them all together is maybe not a super big deal. Like your body can probably adjust to what is a higher priority, um, especially because the body is not mindless when it's absorbing nutrients, right? There's always different concentration gradients, or oh, we have extra low levels of this, so that's taking more priority. And when the supplement comes, like, oh, huge amounts of this just came in, we're gonna take that and absorb it. So I think it's really only critical if you are super, super malnourished that you would
Yeah.
want to make that distinction, which I was because I had a bunch of gut issues. So I did that and it made a difference for me. But I think if you're not super malnourished, then I think it's less of a priority to try and worry about the chemistry of all that personally. Um, I don't know. What are your thoughts on that and your experience there?
Yeah, no, that's why I wanted to ask you. I don't tend to use multivitamins. I tend to try and improve dietary intake and then work on deficiencies and gut health, and go with the theory that the body will absorb, what it needs to if you're adequately providing it. And it does seem to be things like magnesium, zinc, vitamin D, and B vitamins, depending on the patient, that you're then supplementing in
Yeah.
different levels, and maybe chromium if people are like diabetic, and then you get quite specific and niche with certain formulas. But yeah, I don't tend to use multivitamins. I tend to go for a good dietary approach, and then test and treat deficiencies, and then optimize it in the diet that way, and optimize gut absorption. Like you say, the body's so uh, clever about how it absorbs and what it needs to. It's not silly. So yeah, I can't remember the last time I prescribed someone a multivitamin. I just don't tend to
Yeah,
do it.
I usually do them separate. Well, the other thing too is that I found in most multivitamins, like especially where we have the opportunity to do like, if I do more in-depth testing like a Nutri-Eval, like it gives me specific recommendations of how many IUs or milligrams or grams or whatever somebody needs of something. So I can tailor my recommendations really, really well. And I've just found that if I do choose, if I am looking at like a all-inclusive multivitamin, maybe let's help, reduce pill burden or something. The amounts of minerals typically in those are not enough.
Yeah,
Like they
yeah,
kind of suck. And
yeah,
so that's one reason why I'm just like, what is the point of having this in there? And it's like potassium, 50 milligrams. I'm like, what is that? It's like
yeah,
nothing. I don't
yeah,
know. And so, I think that it does allow us to help our patients. Like, we can micromanage things better so our patients don't have to, and we can say, focus on these specific food things, and then you need more support here, so here's a supplement. And we don't have like the all-in-one things. We're just not there technology wise yet to make them work super well, I feel like.
Yeah, no, I think that's a really good point.
Yeah.
Thanks for answering that. So finally, anything you want to add about our friend zinc before we wrap this up?
All right, let me look at my notes of other cool things with zinc.
What
Um,
what does zinc, what's in the cool school for zinc that we haven't spoken about?
so there are other things you can do to help increase absorption, which this kind of goes along with the sources that we talked about. Citric acid and picolinic acid, those are really helpful in increasing the bioavailability of zinc. And then the thing that I thought was really funny is that the paper said something in pancreatic secretions. They don't know what it is. So, but that's kind of an indication, like, if someone has been, having issues with their pancreas, or you do a GI map and you see the low pancreatic enzymes and stuff, that should also make you think about zinc is maybe not going to be as well absorbed. Um, Also, glutathione helps absorption, which I thought was kind of interesting, especially if, you got people with genetic SNPs for glutathione or really high oxidative stress load. And then products of protein digestion, specifically amino acids and tripeptides. And so that's another reason, lower protein diets is going to make the zinc absorption a little bit tougher. And then, of course, the acidic environment, which we talked about. So, those are things to kind of keep in mind if you are on a plant-focused, lower protein diet for that conservative management of your kidney disease. You can talk with your healthcare team about how you can use these other factors to help get the most out of the zinc you're eating. Um, Interestingly, zinc also helps increase folate bioavailability. But if you have really big doses of folic acid, you can reduce zinc absorption. But I'm always like, well, what is a really big dose? And how long does this have to happen for this to be a problem? But it said in doses of 800 micrograms a day for 25 days, they didn't see any reduction in zinc absorption. So you're definitely cool at that level.
Interesting.
Um,
It'd be interesting
so
if it's worse with an MTHFR gene or not.
yeah, exactly right. Yeah.
Mm.
The interplay is so interesting. That's why I'm like, well, what kind of interactions do we see with other things? Um, Zinc deficiency also reduces the release of vitamin A from the liver. So you can see like kind of a trickle down effect if people, are having enough. Um, Technically they have enough vitamin A, but then you're kind of seeing some things that you're like, wow, that seems weird. Why is this not happening? Maybe it's related to zinc. And also, interestingly, um, alkaline phosphatase contains 4 zinc atoms. And alkaline phosphatase is something that, we sometimes look at for bone health, even though it can come from the liver. But if someone's, liver is stable, then it can help you kind of get a idea of what's going on with the bone health. But it can give you a false idea if you have a zinc deficiency. Alkaline phosphatase activity is going to be reduced in a zinc deficient state. So it's not going to be as accurate. So that's
Interesting.
helpful for practitioners to realize. So some other cool things with zinc and its interactions with other nutrients.
Yeah, that is fascinating. I didn't know the alkaline phosphatase
I didn't
part.
either till I did my minerals course. I was like, oh, saving that nugget.
Yeah, that's very fascinating. Okay.
Yeah.
Well, thank you, Lindsay. That was educational as always. That's why I love catching up because I always learn lots of new things. So Thank you. If anyone's out there listening, thinking, oh my goodness, this woman is the mineral expert, I definitely need to chat to her. I will put the details in below, but kidneynutritionalinstitute.org, right? There you'll be able to find Jessiana and the team and all the amazing practitioners they have there. Lindsey being one of the head ones there, doing amazing work with people with chronic kidney disease, and obviously looking at minerals and very much treating you as a person and not a disease, and doing all the integrative testing. If you want to know more about what we do, you can head to www.kidneycoach.com, and you will find us on Instagram and Facebook under the same handles with Kidney Coach. Make sure you hit subscribe and like. That way you'll get notified anytime we put up new info. And if there are any questions you have for Lindsey or any other minerals you'd like her to talk about, and don't worry, we're going to plop our way through all these minerals here, please put some comments below and I will make sure to pass that on to the lovely Lindsey herself. Lindsey, thank you as always. Thank you for listening, and we look forward to chatting to you next time. Bye.